When we discuss breast cancer, so the first thing that comes to your mind as a commoner is it is hereditary, genetic. Does it pass on?
So when you look at any average breast cancer case, out of 100, about 85% are sporadic, which means they don't happen because of any hereditary reason. It's probably just bad luck. But about 15% of patients, it can be hereditary, and that's a sizable number. And how to pick up on whether someone has a hereditary type is if someone's unusually young. Someone has a strong family history of cancers, the dad's side of the family.
Okay.
So it's not like mothers pass it on to their daughters. You could have a father give it to the daughter. The genes can pass from any gender to...
That's a myth being busted here.
Absolutely. So if we pick up on these, so there's a type of breast cancer called triple negative type breast cancer. So even one case, of that in the family can indicate that it could be hereditary. So someone has both their breasts, bilateral breast cancer. So there are some red flags.
So when you do have a family history, you need to have regular checkups.
Absolutely. So anybody with...
How regular?
Yeah, so anybody with a family history should at least approach our genetic clinic. We have a cancer genetic clinic here at Ruby Hall. And it doesn't mean that every patient that walks into the clinic will get a genetic test, or every patient needs to undergo some special tests. So, once you come, but if we do find it significant and we do find a gene, then women with a high risk with a BRCA mutation, you may have heard of BRCA.
Yes.
From Angelina Jolie. So, if you have a BRCA mutation, then we're looking at as early as mid-20s.
Sorry, what does it mean for a layman?
So, BRCA stands for, it's a gene which stands for breast cancer. There's BRCA1 and BRCA2. These are good genes and they prevent breast and ovarian cancer.
Okay.
If someone's carrying a faulty BRCA gene which can be passed on from one generation to the other, then women carrying this gene need to do breast, examinations and MRIs or mammograms.
Okay.
And then some of them may need to have their ovaries removed through a prophylactic surgery. You need to come in and discuss them with the doctor. Women in their 30s and 40s are, planning babies. They don't want to have premature menopause. So a lot of issues, but the aim is to prevent cancer.